name is Brandon. As Rob said, I've been working with Focus kind of since the inception in one way or another. And I've been a paramedic, firefighter, military medic, kind of everything along the way there, and decided to leave the field and kind of come into the medical device realm. If you need to ask questions, feel free to ask. I might defer your answer, though, until another point during the session here. So this is bleeding control for the injured. We are Focus Research Group, and we're working in conjunction with First Care Provider on bringing you guys this material today. So why do you need this training? You know, one thing that we found is that when we polled people on the streets and we asked them, hey, what training have you had for disaster management? More than the majority of them, 44%, said that they had some for employer, some from school. So really most people admitted to having some form of training. But when we started digging a little bit deeper and we asked them how they would rate their level of preparation for a disaster, only about 17% of those people felt that they were adequately trained for a disaster. So again, what this comes back to, and what Rob had mentioned earlier, is that we don't want to just sit here and talk to you, because you're not going to remember everything I say, but you are going to remember everything that you do today. So we want to avoid this group with most training. You know, we want more than 17% of you to walk out of here feeling competent enough to stop a major bleed or treat something that happens immediately. So 100% of the people we questioned said they had training, and only 83%, over 83% were inadequately trained. So the goal is to react to the emergency, and we want to activate others. People kind of, they get blind, they kind of go into denial when bad things happen. This can't be happening here. We heard about the Texas church shooting and people were in denial, but there's no way this is happening at a church, right? The schools, the colleges. But it is happening, and you need to recognize that something is happening, we have to take action. So the number one piece is that we got to make sure that you're safe. You know, if you get hurt, you're not going to be able to help your friends or help yourself. So A, make sure that you're always safe. Activate 911. If you get injured, try and stop the bleeding before you call 911, because again, if you're unconscious, what good do you do for yourself or somebody else, right? And if we never activate 911, then we don't know if help's ever really going to get here and at what point. So we can kind of minimize what happens by making sure that we get to 911 as well. But a part of this is, you know, protect yourself, because there are some people who have illnesses that are contagious. Gloves, eyewear are going to protect you as well. So we don't necessarily want to dive right in and, you know, expose yourself to other pathogens that you might not be able to see. So this class is going to be 80% lab, about 20% lecture. Again, I'm going to ask you to hold your questions unless it's something that you've got the real burning desire to ask me. Go ahead and raise your hand, let me know, and I'll tell you that I'll answer it later. All right, so the tourniquet. You know, tourniquets are designed to apply pressure to your body, and essentially they just squeeze your limb, whether it's your arm or your leg. They squeeze everything tight enough that it all compresses, and it compresses the arteries and the vessels that carry the blood. So if applied correctly, the tourniquet's going to be able to stop all blood flow to the leg. So anybody in here, kind of old school medic, learn, or tourniquets are last case, you know, even in Boy Scouts when I was a kid, right? Worst thing, you never want to do it, they're going to lose. Not true, all right? Tourniquets are very safe, so make sure you understand that right off the bat. These are safe, and you're going to put them on today. The main key with the tourniquet is to limit blood loss. So if we can get this tourniquet on before a patient goes into shock, they have a much higher chance of surviving versus putting a tourniquet on somebody who's already gone into shock. So we want to get it on early, and we want to get it on fast, and we're going to teach you how to identify when to use a tourniquet. So applying the tourniquet is really simple. 1, 2, 3, 4. We want to apply it as high as you can over the limb. So if it's my arm, I'm wearing a shirt. I don't need to take my shirt off. Nice and high. All right? I say go as high up as you possibly can. Pull the band. Pull it tightly. Secure the Velcro. And then you're going to twist this bar. And people are going to ask, well, is it 1 twist? Is it 2 twists? Is it 3 twists? Well, everybody's different. Keep twisting it until the bleeding stops. And you'll be able to see the bleeding stop. In the class today, what we'll do is we'll kind of come around, we'll feel for your pulse, you know, in your wrists and stuff. We'll check your capillary refill in your fingers, and it'll give us a good idea if you put it on tight enough. I can tell you that if you put this on, you only turn it 2 times, it's probably not going to be tight enough. So usually 3 to 5 twists is going to get it on there. And again, there's no hard set number, though, on what works. So I've got this on nice and tight. I've got it to the point where blood is not flowing out of my arm anymore. It's not flowing into my arm. I've got my windlass secured, and then we have this gray strap. We put the gray strap on. That prevents this from popping out and loosening up on accident. Pretty simple, right? So we have our windlass rod. The gray strap secures the windlass rod inside the windlass clip. And then the self-adhering band, so on the tourniquets in front of you, it's just a Velcro strap that's been reinforced. So what we're going to do is we're going to put this tourniquet on about 12 times today. And again, right, it's about what you do and how you do it. And it's important that you guys get the hands-on time now, because it's not the right time to learn how to do this in the middle of an emergency. So when you're doing this to yourself, go ahead and go 100%. If you're doing it to your buddy, the person next to you, go about 75%. So go to that 2 to 3 turns. Your partner will know what's feeling really tight. How many people in here are younger than 18 years old? So 17 or younger. All right, you guys go 3/4. So I don't want you guys really twisting it hard. All right, just give it a couple times. You'll feel some pressure. You don't really need to go all the way. Now, the additional caveat that we want to add to this is that if anybody has any medical conditions, for example, if you had a shunt in your arm for dialysis or something, we wouldn't want you to put the tourniquet on there right now during training. In real life, it doesn't matter, right, because they're going to die if we don't get this tourniquet on. But for training purpose, if you have any medical issues, had any surgeries, anything like that, please feel free to avoid doing it to that side or the arms or legs wherever it's necessary. Any questions about that? That's the safety piece. Everyone's okay with that? All right. So this may be your only chance to practice this skill. And we say practice this skill because we want you to keep doing it. And in all reality, you guys should have some form of practice as time goes on, because if you do it today and something happens in 18 months and you haven't used this tool in 18 months, there's a good chance you're going to forget. So having a practice tourniquet available is always going to be really handy for you. Remember, it will hurt a little bit. You're going to have some discomfort, and it's going to hurt the patients too when you apply it correctly. It's just the nature of the beast. Pros outweigh the cons in using a tourniquet. So I'm going to completely demonstrate a tourniquet again. I'm going to show you kind of step by step what we're doing. Put it on the arm, nice and high, right? So I've pulled all the way up to my armpit. I'm pulling my strap tight. I'm adhering it to itself using the Velcro. Twist the windlass 2 to 3 times, 4 times. I could probably go one more turn for full control. And then we're going to pull this Velcro strap over. Now this is not coming off. Okay, taking the tourniquet off, undo the strap, release the windlass, and then the main strap as well. Okay. The next portion that we're going to teach you is called wound packing. And this is really new. And in fact, both of these pieces are really new to civilian care. We've been doing them in military medicine for 10, 15 years at this point, 12 years at this point. Has anybody in here ever had knee surgery? Perfect. So when you had knee surgery, the doctor put a tourniquet on your leg. And there's a different tourniquet. It's not the same kind. They're usually pneumatic and they're really wide. But tourniquets are safe, right? So they're being used. Knee surgeons, they use them all the time, or when they do hand surgery, they'll use them. Wound packing is kind of the same thing, where it's also new to the civilian sector, and even more new to training non-professional responders. So folks like you guys, being able to pack a wound is a really new piece, and you guys are actually on the cutting edge as far as first aid goes for civilians. So when we pack a wound, we're talking about, could be anything from a laceration, a really deep laceration, deep cut, to a bullet hole, or it doesn't even have to be something like that. You could cut yourself with a saw, a nail could break and penetrate and have a lot of bleeding. But the whole goal is to really fill the void that's created by the wounding tool and stop the bleeding. Now inside, we're going to have blood vessels that are bleeding, and some of the more advanced medics, they're going to feel for the bleeding. But because adrenaline does funny things to our body, there's a good chance that if somebody's bleeding that badly and you're putting your finger in a hole to stop the bleeding, there's a really good chance you're not going to be able to tell the difference between a piece of glass and sandpaper on your finger, because your fine motor skills, they just go away. So when we pack a wound, we want to pull the clothing away just so that we can see the wound. If there's a lot of blood in there, you may want to kind of splash some of it out. You know, use one finger, just kind of get it out. And then when we pack the wound, you know, what I've found to be the best method is get a little bit wrapped around your finger at first. Stick your finger deep down in there and hold pressure. So now I'm never going to stop using pressure and direct pressure with my finger, but I'm going to alternate which finger is actually holding the direct pressure. So as I come in with my left hand, I'm going to swap places, okay? And then I'll come in with my other hand, and I'll do the same thing. And we're just swapping places. And so I'm just going back and forth, and we want to get as much gauze in here as we can. And we'll go until the wound is full. There's a chance you'll probably get maybe half to a third of this roll of gauze that you guys will have that you'll open up inside in front of you. So this dressing that we're going to be utilizing is called a hemostatic dressing. And the hemostatic simply means that it works with the blood to stop the bleeding. So static meaning, you know, not moving, kind of as is. And hemo is for the blood. So hemostatic dressings, the trade name that we're using today is called Clot. You guys have the Clot trainers in front of you. So we will open up these bags. We're going to use the gauze that you guys have in these blue bags in front of you. Any additional gauze that you have left over after packing, what I really like to do, once I've packed a good amount in, I'll put the bulk on top, and then we can hold direct pressure. And we'll add on to that here in just a minute. So we're going to pack the wound 10 times as well. And it's important that you guys kind of get both these down. Now, one thing to know is that as we go through this, anytime we do a drill, I want you to do the tourniquet first, because the tourniquet is always our first step. Because if they have major bleeding, and even if I'm unsure, if I'm questioning whether it's major bleeding or not, just put the tourniquet on, right? Stop the bleeding first, and let's let somebody else, let a doctor deal with it. But as long as we stop that bleeding, it's fine. And then after you do the tourniquet, then we'll go in and we'll do the wound packing. So we're going to do that every time together. And I just demonstrated the wound packing. I'll show you again here. Show you on the laceration, just how it's a little bit different wound. Lacerations are not as likely to cut an artery. However, there's really good possibilities that they can anywhere. And so when you have these deep wounds, I like to get a little bit more bunched up first. Pack inside the laceration, and then work from one side to the other with the additional packing. And all the meanwhile, you can keep using additional pressure on the wound. Some of you might have the lacerations on yours, some of you may not. Again, same process, same concept of packing the wound, keeping constant pressure on the wound. And then once you're done packing, then we're going to hold direct pressure to the wound for 3 minutes. Okay, so what I want you to do right now, we're going to go through this. We're going to do it right. Take your time. This is the first time putting on a tourniquet. So everybody go ahead and get your tourniquet out. You're going to put it on yourself, and you're going to put it on your right arm. Tourniquet on the right arm. So if you have it set up so that this buckle is towards the center of your body, then when you pull it tight, it's just going to happen faster. Yeah, you've got it right. And no way is wrong. This is just easier to do on your own. I think yeah, good. You're good. I didn't feel anything. How's that feel? You're probably right there. You're probably right there. Yeah, good job. All right. So as I was mentioning, as we put it on, if you're pulling towards the center of your body, it's really easy to get good leverage, right? So imagine pulling here. You feel how tight that is initially? Yeah. And then we start to turn. I'll stop there. But let's see. You feel how?
Super tight.
Yeah, super tight. In fact, we accomplished the goal. All right, we stopped the bleeding. Your hand's starting to turn green already. Yep, one more turn, and that's probably all it took. Now there's no pulse. Tourniquets hurt, right? I want you to know that they hurt, but the goal is to save your life, and we're willing to cause you a little bit of pain to stop the bleeding. All right, we're going to do it 9 more times. So now I want everybody, go ahead and open up that bag, that blue bag in front of you. That's got your gauze in it. Now wait, before you open it, yeah, we've got a question. 1 second.
How do you reset the tourniquet?
Great. So this is something that I've gotten in the habit of. And resetting a tourniquet in the field is, right, we really don't reuse tourniquets too often. But in training, resetting a tourniquet, and even my personal tourniquets, I have them set up and I have them staged for my use. So when we're done with the tourniquet, what we want to do is we want to unwind the windlass first. All right? So make sure that the windlass is completely unwound. There's no twist in the band that runs through it. Make sure that this gray strap does not cover up the opening in the clip. Okay? Now, I go about halfway through. Okay, pay attention to what I'm doing before you guys do it. I go about halfway through the buckle, and then I just put about 1 inch or so of this red tip past the buckle. That's it. And then I flatten out the rest. So it's kind of adhering to itself a little bit. I still have a loop. And then I've got that piece there. And from there, you can pretty much fold this up however you prefer. Now, the reason why I do it this way, a couple things. Number one, I can put it on my arm, and I'm already halfway there. Okay, so that's one reason. But the other reason is that, let's say you're working at home and somebody's cutting down a tree, and the tree falls on their leg, but they're bleeding profusely, but their leg is pinched underneath the tree. Guess what? I got to take this all the way out. So if this is nice and tight in here and it's doubled up on itself, it's just going to take me extra time. So if I have to undo this buckle to put it around a leg, I just simply undo it, the strap, and I feed it around the leg, or whatever extremity is trapped. Okay. All right, so now we're going to do some wound packing, and before you guys get started, I want to show you something. This is a Z-fold gauze, so that means it's just layered on top of itself. It's not rolled like toilet paper. Don't throw it over your shoulder, right? You want to maintain positive control over this. It's easier to work with when you have control over it. You ever try, wrapping a rope around something when the rope is all strung out, right? You just have all this work to go around and around. So if you keep control over it when you're packing the wound, it's much easier to work with, right? Versus throwing it over your shoulder or laying it on the ground, and it'll happen. Just roll with it, keep going. You don't want to stop treating the person because you lost control, but just keep positive control over it. All right, go ahead, open it up. Pack a wound channel. We'll be walking around watching you. raise your hand if you have a problem when you're packing or if you have a question. And somebody, myself or Rob, will come over and see you. Not all gauze is packed in this manner. Some of it is rolled. And sometimes that rolled gauze is my preference. Most of the stuff they sell is Z-folded, which is what this is called. Great, good. And again, you just want to keep pressure on the wound as best as you can. Yeah, you're doing it. I know it's tough trying to hold it and pack it. You don't have to wrap around your finger. It's just the best way to get it down into the wound. Yeah, you'll find different ways that work. And really, this is tough to do with 2 feet, right? And that's probably the best you're going to be able to do right now.
This hand, so do I move it into this hand?
No, you can just leave it and loosely hold it. So this is why this is why I like rolled gauze, because with rolled, I just grab it and you pull the center out and it just unrolls inside your hand. And with Z-folded, you kind of get that same problem. Now, one thing that you can do that might be easier is with this gauze, Z-fold, you can try your thumbs too. So if you use a thumb and a thumb, you're just not going to have as much depth with your thumbs. Okay. But you might have more power, more pressure. Okay. But yeah, good. And you'll find a way that works for you. So that way we're keeping constant pressure in there. And so if we are putting pressure on the vein or the artery, it's going to slow the blood flow down quite a bit. So if you guys are going to reset your gauze, right, we packed it all in, it's all out, you guys can roll it. All right, just for simplicity. Now I'm going to show you, I'm going to roll mine up here, and I'm going to show you why I like rolled gauze better. This is the first time. It's more important that we do it right and that you guys get see good examples of it being done right than necessarily having speed. So if you guys end up with rolled gauze somehow or at some point or as you reset, with rolled gauze it's much simpler. As you hold your gauze, grab that first center piece, right? So now it's coming out of the center. And so now as I hold, if I'm going to pack, it automatically unwinds in my hand. See that? And so that alleviates kind of some of the challenges that you were seeing. What do we do with the gauze? If it gets tight, my hand's holding it. It's in the center. So I can just keep going like this all day long and pack it all in nice and smoothly. So that's why I prefer rolled gauze. Okay. Anybody need clarification after that first practical? Okay. So what we want to teach you is we want you to learn how to recognize and treat life-threatening bleeding, the initial steps that you're going to be able to take to make a difference. And so for me, what I like to tell people is it doesn't have to be something bad. You could be moving a safe and it falls and breaks someone's leg and they have bad bleeding. You could be working in your garage, cutting a piece of wood, the blade breaks and you cut your leg real bad. Or you slip and you cut your leg, right? It doesn't matter how it occurs. What matters is that you guys are prepared to deal with it. It could even be cooking in the kitchen, right? Or slipping and falling in the kitchen. It's whatever it is, different things can lead to these different injuries. So it's not just a bad event, not just a terrorist act or getting shot or getting stabbed. It'd be something completely innocent. So we just want to make sure that you identify the life-threatening bleeds. We want you to be comfortable applying a tourniquet. You're going to have to be able to demonstrate how to control bleeding without a tourniquet, right? So that's going to be with our direct pressure and our gauze and our wound packing. We'll kind of talk about some areas that you really can't do much for, such as the chest or the belly. And then also we're going to look at which injuries are life-threatening that we can't do anything for. So there are times where the only thing that they need is to get to the hospital. That's it. So this course has really been stemmed from a lot of the events that have been seen throughout the U.S., but throughout the world as well. Department of Homeland Security started a program called Stop the Bleed. And the whole goal, again, is to raise awareness. And does everybody know what an AED is? Has everybody heard what an AED is? right? So if you're walking in a mall and someone has, they go fall down and they're unconscious, we know, hey, get an AED and call 911. That's pretty standard. Well, we want this to be the next standard as well, with the intention of everybody can make a difference in somebody's life. And this all came from the Hartford Consensus, where essentially the group of the nation's leading law enforcement and health organizations, they came together and met in Hartford, Connecticut, and they came to a consensus that recommended that all citizens learn how to stop the bleed. I know a big thing in San Diego that they've been doing this hands-only CPR, right, where they'll teach you just how to do CPR just with your hands only. And they've got these apps, that tell you where someone needs CPR called Pulse Point. This is along those same lines of allowing you to take one extra step to make a big difference. Okay, tourniquet, left arm. Put it on yourself. Self-aid, left arm. You feel a difference pulling towards your center? The tighter that strap is before you start turning the windlass, the easier it's going to be for you.
Does this go under the gray?
It can. So you can do that. It does not have to. Okay. And if you do that, that's one extra piece. All right, before you guys move on to the next wound packing, let me show you a quick piece that Betty brought up here for me. And so as we wrap the tourniquet, right, we get all this Velcro on here, and I start turning, and once I get the windlass tightened to where I want it, one added step that's going to prevent this from coming off accidentally would be to take the remainder of this strap and put it through the clip. And then when I put this gray strap over it, now if this comes off, it's not going to accidentally come undone. So it's an added security measure. Again, that doesn't need to be done immediately. Again, the most important piece here is stop the bleeding and then secure the tourniquet so that it doesn't come off accidentally. All right, go ahead and pack the wound. Try and keep direct pressure on it. So one thing that's to know is you can bleed out in about 3 minutes from the right wound. You can lose consciousness from the right wound 11 to 15 seconds depending on where that wound is. The faster you can get pressure on a wound, the better off that person's going to be. So now as you guys are holding pressure, you might need to call 911 or something. So something that you guys can do is, depending on where the patient is or the person is, if they're laying down, if they're not laying down, right, if we're holding direct pressure, if they're on the ground, you can always put a knee on them. And if you put all your weight on that knee, you can essentially have all your body weight being focused into that point of your knee. That's going to put a lot more pressure than I'm able to put with my hand. So you can think about these things a little bit differently, because if you do need to free up your hands to call 911, if you're the only one there, you got to call 911. You got to get to that point, but we also don't want to let up on the patient to use our phone, and then they start bleeding again, and now you're doing one of these Three Stooges acts going back and forth between a phone and a bleeding patient. All right, I'm going to move on. Go ahead and reset your gauze as I'm talking here on the next one. If you guys want to try and Z-fold it, feel free. If you want to roll it, whatever works best for you. That's one other piece too, is you guys are going to find techniques that work for you, and they might be a little bit different than what I'm saying. As long as the end result is the same, I'm happy. So the standard response time when 911 is called. So the greatest percentage of the population has a 5 to 7 minute standard response time. The goal in most municipalities is a 7-minute response time. So down here, Los Angeles Fire Department, average time 6 minutes, 36 seconds. New York Fire Department, FDNY, 8 minutes, 56 seconds. So almost 9 minutes. That's a long time. So this is why you should care about being able to take these steps that are going to save someone's life. Again, this is on a normal day. So with all the fires that we've had down here in San Diego, you think that's going to affect response times? I think we have fewer resources available for the general public, right? Because some of them are committed to the fires. Who remembers back in 2011 when the power went out to the southwestern United States? What do you think response times happened to during that? Traffic lights weren't working. Every single road was just completely flooded with cars. It took me an hour to go 4 minutes on Palomar Airport Road, or an hour to go 4 miles from one end to the other end of Palomar Airport Road. Right? That's a long time. So imagine what that's going to do to your 911 response time. You have to be able to protect yourself. I tell my kids all the time, I do my best to protect you, but I can never protect you from yourself. Right? So protect yourselves. Take actions to protect yourself. And then what happens after you call 911? All right, so what if they can't get to you? In the event in Las Vegas, there were a lot of different factors, a lot of varying factors that prohibited people from helping. So I want you guys to know that in this type of scenario, and you call 911, do you think an ambulance is going to come right in the middle and pick you up because you have a gunshot wound? It's not happening. In fact, because of how widespread this was, the ambulances, which are operated by a private company, their initial response, their standard is to stay 1 block down and 1 block over, right? Well, this is a huge city block. This is not a small area. So these ambulances are staged. They're waiting. They're just sitting in their car waiting for the all clear. And then what happens is these people start showing up with wounded patients. Well, what about the people that are so wounded they can't walk? And they can't get up, and people, you know, right? So you got to think about what really happens when you call 911. So, you know, these are the different ways that bleeding is stopped. And reading from left to right, we're going to look at the people who are there when it happens, right? You guys are working together in the garage, you get cut, boom, someone can take action, and that's going to be your immediate responders. That's you guys. The firefighters, paramedics, police officers, you know, they're what we call the first responders. And again, that could take anywhere from 7 to 10 minutes, or if it's a sheriff's deputy showing up, it could take 20, 30 minutes, depending on how rural you are. And then ultimately, as you get into the hospital, we have physicians and trauma surgeons who are able to take additional steps to stop the bleeding. And it's that entire chain that really matters, because not one of these exists without the next phase happening. So the fire department depends on somebody calling 911, and the hospitals depend on the fire department and the paramedics for getting you there, and so on. So everybody works together, and if you guys can stop bleeding at this point, there's a really good chance that the person is going to walk out of the hospital from here. Walk out on their own 2 feet. Okay. So now what I want you to do is put it on the person sitting next to you. If you are on the left of your table, you're going to put the tourniquet on first. So the left side of the table, you're going to put the tourniquet on first. All right. All right. Okay, good. You guys good? How'd that feel?
It hurts.
It hurts. Yeah, it's uncomfortable, right?
Yeah.
Oops, sorry. Good job, guys. All right. If you're satisfied, swap. The other person put it on. That feel good? There you go. Pull nice and tight, and then put it down here. You ready? Here, pull tight. Is this your brother? Yes. This is your chance to hurt your big brother. There you go. All right. Now turn this. Keep turning that until I tell you to stop, okay? How old are you? Yeah.
I'm 14.
Okay. Keep going. Keep going. You can use your 2 hands. You want to turn it nice and tight. Go one more. If you can get one more in there, you're going to be great. There you go. Now put it down inside that clip. Great job. That's awesome. You did a good job. You did it. All right. Can you take it off now? All right. After you're done with your tourniquets, reset your tourniquets, grab your wound cube, and go ahead and pack a wound. Okay, 25 seconds has elapsed since I told you to get the wound cube and pack it. All right, let's see how much you got in there. Oh, that's great. Yeah, you feel how solid that is?
Yeah.
That's what you want. If you have room, you can always kind of go to the outside too. But you did good, right? You're not by all means, it's not wrong. Let's see how tight that you got that pat. Oh wow. Great. Feel how solid that is?
Yeah, it was way easier rolling it out.
What if you use all of it?
That's great.
Okay.
Right? So then yeah, that's great.
Okay.
Yeah, so if you use it all and you have a wound that's big enough to use it all, then you use it all. And if you need to add more, you can always add more.
Okay.
So if after holding pressure for 3 minutes, you guys notice that blood is starting to seep through, leave this in place and get another pack or another piece of gauze and pack on top of that and hold pressure on top of that. The question was brought up, well, what if you use it all? Well, okay, you used it all. The goal is to fill up the wound cube, right, as if it were a real person with gauze. You want to eliminate any void that might be inside that person. And by eliminating that void, what happens is, imagine filling up a bucket with a hose, right? And it's going to fill up and that hose is going to keep flowing. But if you pack sand around that hose that's in the bucket, you think it's going to fill up as fast? Right? So you want to fill that area up, and it's going to help the clotting process. It's going to create pressure in there that puts pressure against the veins and the arteries, which further helps to slow down the bleeding. And as bleeding slows, the clotting cascade speeds up. And as that clotting cascade speeds up, you get a nice big fat clot in there and bleeding stops, ideally. Sometimes it doesn't work that way. So a lot of the information from this course has been taken from primarily the military and what we call Tactical Combat Casualty Care, TCCC, or TCCC. And the use of these tourniquets really was not mainstream until about 2001, 2002, after 9/11, where we started having more and more wounded soldiers on the battlefield that required additional steps to stop the bleeding. And so tourniquets really made a big comeback. So within the last 15 years, what has happened is tourniquets have gone from this big no, don't use them, to now they're mainstream and everybody's learning how to use them, like you guys. And this was all driven by what we learned in these wars. And wars are unfortunate, but the good thing that came out of them is that we're going to be able to save more lives here, in our home country, because we have advances in medical care because of them. We're also utilizing the Certified First Care Provider curriculum, which, again, their drive is to come together and let's get more people trained in how to stop bleeding on these life-threatening wounds. Committee on Tactical Emergency Casualty Care Guidelines, that's kind of the civilian version of the TCCC. And then Pre-Hospital Trauma Life Support course, which Pre-Hospital Trauma Life Support is like a trauma course at the paramedic level, but they actually own the TCCC curriculum as well. So there's kind of some pieces tied together here. Right now, this is all being co-sponsored by the First Care Provider Foundation and the American College of Surgeons. So that's kind of where the big drive has started with all of this, and a lot of this material has come. So importance of the first care provider, and Colonel Nicholas Senn said this back late 1800s, and he said that the fate of the wounded rests with the one who applies the first dressing. And essentially, what that comes back to is when we were talking about the immediate responders, you guys, if I get hurt right now, my outcomes depend on you and what actions you're going to take. And it's going to be the same everywhere you go. It's not just on the battlefield, it's not just in the hospital, that's everywhere. The fate of the wounded lies within he who provides the first dressing. Now, if you're sitting on the right side of the table, put it on your buddy's right leg. Right seat is applying the tourniquet on the right leg. Time out, time out, time out. We missed a safety piece earlier. All right, if you have anything in your pockets, don't put a tourniquet over it, okay? All right, it's okay to put it over clothes, but you don't want to put a tourniquet over keys or a pocket knife or anything like that, all right? You're going to notice that you're going to have to pull much tighter on the leg in order to get the same feeling that you get on your arms. Everybody has fat on their legs, and fat is less dense than muscle. And so as we compress this tissue, you have to compress more tissue and apply more force in order to occlude the blood flow. A little bit tougher to feel for a pulse. I'd have to touch your feet, and I don't like feet. All right, if that feels tight, I want you guys to realize that the legs take more pressure. There's no doubt about it. You need more pressure on the leg to occlude blood flow. You have more tissue to compress, right, before you even get to the artery that's really deep inside on the inner leg. So I noticed, too, as we're doing this, some tourniquets look pretty low. That's fine in the training environment, I understand, especially if you have stuff in your pockets or if you're wearing a skirt or something. But in real life, we're going to want that tourniquet as high as you can go. All right, everybody's getting faster at putting on tourniquets. Does everybody feel like they're getting better? So this is a perishable skill. You guys saw how the first few times we were really going slow. I was having to provide a little bit of feedback. But now you guys got it and you're going. Keep up with practice, right? Because again, you don't do this for a year and you come back to the same class with me, we're going to be right back at square one. So, all right, with your wound cubes, pack it with your eyes closed. So focus on that pressure, right? Keeping pressure on the wound is the most important part here. As long as I hold pressure directly on that wound, it could take me 2, 3, 4 minutes to pack the wound because I'm holding direct pressure and therefore the patient's not bleeding a whole bunch. We're not wasting time. We're still doing something for the patient because we have that direct pressure. That's why we want to emphasize to hold pressure as you're packing the wound channel. These wound cubes give you the perfect opportunity to feel a simulated environment of what a penetrating wound would look like. So as we pack the wound cube with gauze, essentially that should feel nice and firm inside that wound pattern. It should feel almost solid. And if it feels almost solid, you've done a terrific job of packing the wound. If there's some flex in it, that means there's air in there. And air in there means that it's going to keep bleeding. All right, go ahead and reset. That's where we want this to happen, though, is right in practice. We want to make mistakes in practice so that if it happens in real life, we don't make mistakes. All right. Any questions thus far? Great. You guys are doing really well. You guys are doing really, really well. You're getting the wounds packed. You're getting direct pressure on. As we kind of go through the standard with tourniquets, when we used to test on these in the military, the standard was less than 60 seconds. And I'm confident that by tonight, by the time we're done, everybody in here will be able to do it in less than 60 seconds, no problem. So moving forward here, identifying injuries. And before you can begin care, you're going to want to identify the location of the injury and whether or not it's life-threatening. Okay, so life-threatening being the key word here. A life-threatening injury, guys, we're going to look for anything that is active bleeding. And the easiest way is if I turn on my hose, even a little bit, and you're looking at the end of that hose and water's just coming out, right? Even though it's not forceful, water's just flowing out, okay? So think about that. Anything equivalent to that or greater is life-threatening. Now, if it's just a real slow, right, we've all cut our fingers, a pinprick, and blood just slowly starts to appear, right? It's not really flowing. It's kind of like an ooze, almost like lava, right? Just nice and slow and it's thick. Okay, that's not life-threatening. But if it looks like there's a flow to it at all, just consider it life-threatening bleed. Easiest way to put it. So what this red tube signifies, this is actually an arm. It's the right arm, and that's the patient's right leg. That red tube is actually in fairly correct locations for the major arteries that supply the limbs. So in the arm, it's on the inside, right, because it's protected from the outside. And on the leg, kind of comes from the center, and then it branches outwards and runs down the inner leg as well. So that's where we're compressing. That's what we're doing to stop the bleeding, is we're compressing those arteries. Okay, put it on your right arm. Go. You're dying. Uh-oh. Now you're really throwing yourself through a loop. Don't stop. The faster you can get it on, the better you'll be. Keep going. There you go. You may do, man. Good job. Good job. All right. Raise your hand if you're done. Awesome. Okay, that was 35 seconds from when I said raise your hand. Great job, guys. Feel good? Feel tight? All right, go ahead and take it off. Okay, nobody start packing their wound cube until I tell you to go. We're just going to set some benchmarks here on how quickly you're able to do so. Remember, the key here is pressure, not speed. We have a saying, slow is smooth and smooth is fast. It kind of applies here, right? Take your time, keep pressure, and 2, 1, go. You're doing great. That's awesome. That's exactly what we want to see. Yeah, you know, the smaller the wound pattern, the harder it is, right? It could be deeper, so it's tougher to get both fingers in. Then you have these really large wound patterns that feel like you could stuff the whole roll of gauze in there right away and then pack on top, right? So everything is different, and just know that nothing is going to be exactly the same. No two wounds are identical. These wound cubes are terrific training devices because they allow us kind of different opportunities, but they allow us to get that muscle memory of packing a wound. All right, good job. Go ahead and reset your gauze. And again, it's not necessarily about time. I want constant pressure on the wound. Kind of reminds me of in the cartoons when the dam springs a leak. And someone, they plug the hole here and over here and up here, right? And you're kind of just struggling to plug all the holes. Kind of the same thing, right? It's just a balancing act of pressure with packing. You know, the benefit with the Z-fold is you can take, if you have a really large wound, you can take a good chunk of it and kind of get it into the wound as you start packing. So that's the benefit, because if it was rolled, you wouldn't be able to take a big chunk of it right away. With the Z-fold, I can open it up, I can pinch half of it, and I can have half of it in the wound right now if it's a big wound. And then I can pack with the rest of it. So kind of trade-offs on everything, and my preference may not be. Okay, so causes of bleeding deaths. So we can do a lot for bleeding, right? I don't care where the bleeding is on the body, you can put direct pressure on it. And if it's bleeding from the surface, right, i.e. I'm not bleeding from my heart, I'm bleeding from a cut in my skin, you're going to be able to make a difference no matter where it's at in the body, right? Arm and leg bleeding, all right, so that's kind of what we've been working on for the most part here today. And that can be controlled with direct pressure, we can pack wounds, we can use tourniquets. Junctional bleeding, think of anywhere that a limb attaches. So my hips, my armpits, and where my head attaches. These are all the junctional areas. You can't put a tourniquet on there, all right? You can pack the wounds there. You can do some direct pressure. But typically in these junctional areas, the arteries are in the deepest portion of the area. So where the artery goes through my shoulder is almost dead set, center of my shoulder, underneath my bone, right? Same thing in my hip. It's all the way on the inside and it's really deep. It's protected. So it's really tough. You can't put a tourniquet on because of the location. And packing, you're going to have some deep wounds in those areas. And then internal bleeding. So if you think about anything on my torso, right? If I had a cut on my torso, fine, right? We can control that. You can put some of this gauze on there and you can hold direct pressure on it. But if I'm bleeding from within my body, all right, if I get in a bad car accident or I get shot or I fall off a ladder and land on a fence post, right, that's all going to cause internal bleeding type injuries. And it's very, very important to know that there is nothing that you can do for this patient. All right, so internal bleeding, you can't do anything for them. As a paramedic, there's almost zero that I can do for them. And as a civilian paramedic, there is nothing I can do for them. The only reason I can do a little bit is because the military said I could do a little bit more than what we do out here in the real world, right? So this area is deadly. And earlier I mentioned the only thing that's going to save that person is getting them to the hospital. Right? So bright lights and diesel is what the firefighters say, right? We're going to treat them with bright lights and diesel. Lights and sirens, let's go to the hospital as quickly as possible. So any victim who's bleeding from an artery can die from as little as 3 minutes. Know that you can die sooner than 3 minutes from an arterial bleed. The subclavian artery that runs underneath your collarbone, you're going to lose consciousness in 10 to 20 seconds. You won't be able to be revived after 30 seconds or so. It just happens that fast. The bigger the hose, right, the more fluid leaves your body. The faster that fluid leaves your body, the less chances are for survival. So you can die in as little as 3 minutes. Serious bleeding is the most frequent cause of preventable death from injury. Now, preventable death. So the way we see it is that nobody should die because they're bleeding from their arm or their leg, right? With what I've taught you today, you guys could save every person that you ever come across, essentially, who's bleeding from the arm or the leg, granted you're there in time. Right? We want to get that stuff on before shock sets in. Life-threatening bleeding requires immediate attention. So pressure stops the bleeding. Tourniquets, as you guys are very well aware of now, they apply quite a bit of pressure, right? And we want that tourniquet high, and we want it tight. Pretty simple stuff. Okay, self-aid, left arm. Go. Anybody in here left-handed? You are? All right, let's see how you do. You did a great job. You guys are kicking butt. All right, you can go ahead and take it off. All right, go ahead and pack your wounds. These wound cubes, they've got a larger injury on one side and a smaller injury on the other side. If you've been packing the smaller injury, let's go ahead and change it over to the large and vice versa. Constant pressure on that. Great job. Everyone's doing really well. All right, so we talked a little bit about wounds on the limbs, right? Arms and legs, tourniquets, packing. On the legs, arms, really, we're just going to go straight to a tourniquet. But on the junctional areas, groin, armpits, the neck, we can't put a tourniquet on. And despite what you may want to do to some people, you cannot put a tourniquet on their neck to save their lives. So we need to apply direct pressure, all right? And part of that direct pressure, we got to get a little creative here. So how can we apply direct pressure and then pack the wound at the same time? Some areas, right, require more pressure than others. On the neck, a lot of the times, depending on where it is, you can feel pulses and you can say, oh, that's where I want to put direct pressure. Whereas when you're doing down here on the legs and in the groin, it's such a big area. And unless you know where those arteries are, your direct pressure could be fruitless. So the next best thing is going to be to pack immediately with the hemostatic agent. So the hemostatic gauze, plain gauze will work as well, but really, same thing. We're packing, and instead of it being on a limb, it's simply in the armpits, in here, right, these junctional areas. So if I get hurt here, there's a lot of vessels here that can bleed very quickly, and I can't put a tourniquet here. So really all I have, the only option is to pack this area, right? So again, with the wound packing, apply and hold continuous pressure for 3 minutes when you're using the hemostatic gauze. And if you're using regular gauze or a towel or a shirt, 10 minutes, right? 10 minutes. So this gauze, the Quick Clot, there's other name brands out there, but this hemostatic gauze, this essentially speeds up the clotting process, right? So it just helps it to move faster. So we pack the wound, hold direct pressure for 3 minutes with the gauze. After that, when we reassess, we don't want to pull that old gauze out. We're essentially going to take our hands off after 3 minutes, and I'm looking. Is that gauze turning red? or is it staying white? That's it. We don't ever want to pull it out because you can take the clot with you, right? If it failed to stop the bleeding, we can grab more gauze and pack on top of that. Never remove, but we can always add to. Over here, we were able to get the entire roll of gauze into the wound cube. That's okay. If it were any bigger, we would have needed a second roll of gauze or a towel or whatever we were going to use at the time. Obviously, towels you can't pack very well because they're so wide and bulky. That's why we like this gauze. It's narrow, and we can get it into the crevices. We can also wrap to secure the packing in place. So we can wrap it with an ACE wrap. We can wrap it with gauze. If I have enough left over from packing the wound, you can wrap it with this as well. Right? We don't want to compromise the pack to have some left over, but that's always a possibility. Now, if you think about this, if we have a really bad wound and this person is now semi-unconscious, laying on the ground, and they're not moving, and I'm holding pressure for 3 minutes, and then I get up and they're not bleeding right now. Oh, cool. All right, bud, you're all good. Let's go. And he gets up, and guess what happens when he starts moving and he starts stretching? What happens to those clots, right? They're going to break free, and he's going to start bleeding again. So there's really a good opportunity that you're going to need to pack more. So keep that in mind. Compression bandages, rolls of compression bandages are essentially, think of an ACE wrap that's got a big piece of gauze on it and stuff like that. Those work really well because you can stretch them nice and tight. And I'm sure you've seen this. Whether you use an ACE wrap and it's too tight and it causes pain, well, if you pull that ACE wrap tight enough, and you guys are going to see here in a little bit, you pull that ACE wrap tight enough, you can stop blood flow almost completely with an ACE wrap. But those are always good to wrap around a wound as well. So you pack the wound and then you put ACE wrap on. Guess what? It's like someone's holding pressure, but I'm hands-free. All right, buddy aid, right arm, left seat. Quick. I hear phones. How'd she do? Huh? Yeah? See, is it tight enough? Is it tight enough, though?
70%.
Good? Great, take it off. All right, on to the wound cube. Go ahead and pack that wound. You guys have 1 minute to pack the wound right now. I want you to work on the pressure. Let's work a little bit on speed, but remember, slow is smooth and smooth is fast. We want that constant pressure, and we don't want big gaps in the gauze, right? So a couple inches at a time when we're packing of gauze. If you take a bite of that gauze too big at any one time, then that's going to create air gaps within the wound cube. Blood will not clot as efficiently. All right, go ahead and reset them. We're going to move on here. So I've talked about direct pressure, right? And as we're packing, we want to maintain that direct pressure. These arteries, most arteries, are smaller than your thumb. And a lot of the real small ones are really deep, and they're protected by bone in certain areas, right? So using your finger on certain areas, right? If it's a lower arm, we can, like where I've felt some of your pulses, right? I can kind of go do direct pressure right there if you cut your finger off. I can do direct pressure right there and stop blood flow to your entire hand. So it's not necessarily always big, huge areas. We can use fingers, your knee, your hand. If I have a patient with a groin injury, I personally am going to be kneeling down directly onto the femoral artery, and it's going to put that direct pressure on the artery that feeds the leg. We'll go from there. So bleeding control without the hemostatic gauze requires firm direct pressure for 10 minutes. We don't want to stop early. We don't want to come off at 5 minutes and be like, oh yeah, let's check. Well, it's only been 5 minutes. Wait 10 minutes. 10 minutes, and then check. So when we talk about internal injuries on patients, wounds to the torso, right? So really anything that's not on the arms or legs, head or neck, can cause internal bleeding. And we don't want to pack these wounds because there's a lot of stuff going on in there. And in all reality, you're not going to pack my belly enough with all the gauze in this room to stop the bleeding. A, there's a lot of pressure because the hoses are really big inside there. And B, there's a lot of space and skin is flexible and stretchy, so we can pack a lot of stuff in there before it really has the same effect as it does on your legs. We can't do anything for these guys outside of the hospital. Open injuries, right? You can see the injury. We can cover it up. We want to make sure that they're able to breathe comfortably as best we can. But other than that, they need to get to a surgeon, period. A surgeon is the only thing that's going to fix a gunshot wound to my belly. Nothing else will save it. Nothing else is going to stop the bleeding. Nothing else is going to keep me alive except for a surgeon. Buddy aid, right leg, go. You did it fast though, that's good. You had a 50-50 chance. All right, once each member has done it, go ahead and reset your tourniquets. You guys have mastered the wound cube. So we're gonna skip wound packing for the remainder of the course. All right, reset your tourniquets. We are not wound packing. So moving on, with these injuries, we want to prevent exposure. And when we say prevent exposure, we're essentially talking what's happening between the patient and the environment. So as you bleed, right, we're warm-blooded. That warm blood keeps me warm throughout my body. So as you bleed, you're losing the ability to stay warm, right? So bleeding equals heat loss. Well, the colder your body temperature is, the lower your body has the ability to clot. Your blood does not clot as well. So I'm bleeding out. I'm losing a lot of blood. Therefore, I'm getting cold, and you're trying to help my blood to clot, and it's not going to clot as fast. So what we want to do is we want to minimize the victim's exposure to weather and the elements. So if they're outside and it's cold, bring them inside where it's warm. If it's raining, get them out of the rain. We want to essentially do everything we can to keep the person warm and dry. So if they have wet clothes on, yes, take off the wet clothes and cover them up with something else. Sleeping bags, blankets, shirts, flannels, whatever you can get to pile on this person to help keep them warm, great, do it. It is as important as stopping blood loss. And it's easier to prevent hypothermia, which is being too cold, than it is to treat it. Much harder to bring somebody's temperature back up. So with tourniquets, again, apply them immediately to life-threatening bleeding. If you're not sure, it's life-threatening. Okay? Pretty simple. High and tight. I tell my students, as high up on the limb as you can go. The old rule used to be 2 inches above the wound. No. As high on the limb as you can go. Don't put it over anything in the pockets, right? No keys, no pocket knives. As high on the limb, nice and tight. It's going to hurt. So if you're talking to somebody and you're saying, hey, I'm going to put this tourniquet on, it's going to save your life, but guess what? It's going to really hurt, but it's going to stop the bleeding, it's going to save your life. Pressure stops the bleeding, right? These tourniquets apply pressure, and that's our goal, right? Our goal is to compress that artery and stop the blood flow. Okay, self-aid, right leg. Good, good. How you doing, guys? Go ahead. Yeah. Yeah, at this point, you guys know what's good and what's not, right? This is a very simple task. So this practice, again, practice is going to allow you the ability to do this in 6 months. So we're going to look at the SWAT tourniquet. SWAT stands for stretch, wrap, and tuck. If you guys look at this, you guys notice there's some writing on there, and there's some diamonds, right, and squares. And essentially, when you stretch it, and that diamond within a circle turns into a square, that's how far you want to stretch it once you're really tightening it up. But now this is rubber, so it kind of slips on itself. So there is a technique to itself, okay? So when you're doing this to yourself, obviously it's much easier to do it to your leg because you have 2 hands, right? So you want to get a couple wraps on here before you really start to pull tight. All right, so now that it starts to bite on itself, now I can pull tightly. All right, so you see I stretch it and I'm wrapping it. Same thing. We do that all the way around. And one thing you'll notice is that because this is a wider strap, actually requires less pressure overall to compress the artery. Wider, less pressure, more surface area. And then we're going to wrap it up, and then we'll tuck it at the end. So as we go about and we do this, the first time, why don't you guys just, I think we have you do it to your legs. Well, no, we'll do it to your right arm. Anyways, wrap it around, tuck it in on itself, and it's not going anywhere. It'll essentially hold itself in place. So I really didn't do a great tuck job on it, but this is not coming off. Okay, self-aid, right arm with the SWAT T. Yeah, the hardest part is getting it started. Oh, yeah, and then you let it unroll, and it's even worse. So if you do 1.5 to 2 loops really loose, just get it over itself first, and see if you should be able to give it a nice, good, tight pull after that. Now, it was brought up earlier, you know, these have their place, but you guys can see it's a little more challenging to apply one-handed, right? Yeah, the tucks, right? So you kind of loosen up your last wrap and just make sure, there you go. That way it's loose enough you can get it tucked. And it's got its place, right? It works. I know that. All right, go ahead and reset. So, you know, in summary, you guys, a lot of this, we're not just done just yet. We've got a few more slides. But kind of what we want to make sure we do, the whole process of everything that we talked about tonight. Number one, make sure you're safe. Call 911. All right, provide care for the injured with direct pressure and wound packing, tourniquets as needed, protect them from exposure, and then ensure that first responders evaluate torso injuries. So again, when we talk about those areas that we can't really do anything about, make sure that if you call 911, you say, hey, this guy, he's bleeding from his belly really bad. Make sure they know that. It's just good practice to pass it off to them. Self-aid left leg with the SWAT T. This will be a little bit easier for you guys now. You can use 2 hands a little more effectively. You can hold it in place. You can get that good stretch. Now I want you guys to notice the difference on your leg. Utilizing this band versus the tourniquet, which one hurt more? You guys know, you know why? It's wider. The same amount of pressure that you're applying with that tourniquet is over a wider space. So it's compressing more tissues, right? And so the wider the band, and this is why I mentioned earlier with surgeons, they use these really wide pneumatic tourniquets when they do surgery on your knees and stuff, because they don't have to use much pressure at all. And it doesn't do much to you. Okay. Everyone okay with that? More or less, we want to make sure that you guys see some of the different stuff that's out there. And what you guys have done today is you've covered 2 of the primary tourniquets that you'll see on the market. So what happens if you guys help somebody? Can you be sued? Well, no, you can't. Because the Good Samaritan law essentially says that if you're acting in good faith and you're not being paid to do so, like if I was on the job as a paramedic, I could be sued if I didn't know what I was doing. But I'm not on the job, even though I'm a paramedic, I'm still not on the job. So if I stop to help somebody, I'm doing it in good faith. And that good faith effort means that I can do my best to help you. I don't have to stop. I have no duty to act. I don't have to stop and help you. But if you guys help somebody, it's the same thing. You don't have to help them. And because we want to encourage more people to step out and lend a helping hand when able, Chapter 9 of the Good California legislator essentially says that no person who in good faith renders emergency medical care or non-medical care shall be liable for civil damages. You shall not be held liable for damages. So you're protected if you help people. So don't let that ever stop you from helping somebody. So how many trauma kits do you need? It's a great question, and that answer varies by location, by setting. I have 1 trauma kit in my house, but guess what? It's a big kit. I've got 2 kids, I've got a wife, and I've got a dog that if something, God forbid, ever happened to her, I've got to be able to help her out as well. So I have 1 large kit. But I also have a kit in my truck, and I've got a kit in my wife's car, so that essentially anywhere I go, I'm protected, right? Out on the track field, you'll probably have one kit that you can use, but it varies. There's no right or wrong answer, but I will tell you it's better to have it and not need it than to need it and not have it. All right, any questions for me? Yes?
Is 911 first before you even pack the wound?
It depends, right? My thoughts on this. If you can stop that bleeding before you call 911, that person is going to be better off versus taking the time, the extra 30 seconds. Even if you just do 30 seconds, 911, put it on speakerphone, and you set it down, and you go to work. I want that bleeding to stop, right? I want that bleeding to stop. That's first and foremost. So, wrapping up here, you guys are now educated, and you will be equipped when you leave here tonight. Part of our gifts for you guys is that we're going to be sending you home with a kit of your own. Now, I want to mention that with that kit, there's a tourniquet in there, but it's not a training tourniquet. Right? We should never use our training tourniquets in real life because they've been used over and over and over and over and over again, right? And the more you use something like this, there's a good opportunity that it could break or fail. So it's always a good idea to have a training piece and then a piece that you don't use except for if the need arises. You guys now, we talk about the circle of influence here. Everybody here knows somebody, right? So when we talk about it, whether it's here in the church, which was brought up that, hey, what do we do if something like this were to ever happen? So from that discussion, different things started to occur, which kind of leads us to where we're at tonight, right? So whether it's at your place of business or you're at school, is ask the question, what do we do in case of an event? What do we do in an emergency? And use your circle of influence, because in all reality, if you're the only member in your circle of friends that knows how to do this stuff, what happens if you're the one that's hurt? Who's going to help you? So this is a great opportunity, people to come together. People you know, come back with them, right? Come back with them when they do the training. Sit through it, get more practice. It never hurts. And that's the other part, is we want to practice these skills, right? Muscle memory is a perishable thing. So what you've learned tonight, tomorrow you'll probably be okay. Next week you'll probably be all right. But if we came back in a month and you guys haven't practiced this, or you haven't seen it or even thought about it, there's going to be that little, we're going to have to do a little catch up, and then you'll be off and running again. So practice is great. It helps develop that muscle memory. Now, fake medical devices. All right, so a lot of this stuff is not very cheap. You know, they're not expensive either, maybe $25, $30 or so for one of these. So keep this in mind. When it comes to medical devices, when it comes to the wound cubes, if you see something on Amazon that it's like, oh wait, no way, $4 for a tourniquet, it's probably too good to be true. And so there are unfortunately people out there who knock these tourniquets off and they make fake ones. In fact, we had a sea container that we located in Afghanistan that had 80,000 fake tourniquets that somehow were sold to the Afghan military. And the problem was these windlasses, they were not strong, so you start twisting them, they'd start breaking. Right? So there are people out there who are going to try and capitalize on our growing independence and our ability to treat ourselves and take care of ourselves, and they're going to try and capitalize on it by making fake stuff. So make sure you get the right stuff. Make sure you get good stuff. If you have any questions, all of our contact information is on these brochures. You can always shoot an email into the office, and we'll make sure that you guys get taken care of. It really does mean a lot, especially to the community and everybody that you guys are with. You may never use this stuff, but again, best to have it and not need it than need it and not have it, right? And with that, we conclude. Thank you.